You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers! Today we revisit a Facebook Live recording from our Hydro Vet Rehabbers Facebook group, where I talked to Angela Griffiths from Griffiths Hydrotherapy and Rehabilitation Centre in Guildford in the United Kingdom. We had a Q&A session about hydrotherapy for patella luxations, and we looked at post-operative cases as well as those that are undergoing conservative treatment. But first, a word about our sponsors. PulseVet are the global leaders in veterinary shockwave technology. They manufacture the ProPulse and Versatron family of products. And now for those of you who don't know what shockwave therapy is, it's a non-invasive high-energy sound wave therapy that can be used on both small and large animals to treat multiple soft tissue as well as musculoskeletal conditions. With over 20 years of clinical research, PulseVet is used by top veterinarians and veterinary rehab therapists to improve the quality and speed of healing, to relieve pain, stimulate bone and tissue growth, and to improve the mobility for their patients. For more information, you can go to pulsevet.com, and you can also meet the PulseVet team at their virtual exhibit stand at the Vet Rehab Summit in November. Right, let's have a listen to that Q&A session. Welcome, guys. So today we're going to be chatting about patella luxations, and we have two major groups of patients that we'll be dealing with. The first one would be those dogs that are just having a conservative management, so probably grade 1 and possibly grade 2 patella luxations. And then there's another group which would have had surgery and will be treating them post-operatively. So to start off with, I'm just going to get Angela just to discuss a little bit about those two different groups and how we would manage them.
Basically, we have dogs referred for hydro which fall completely into two groups, either conservative management because they have mild grade 1 or grade 2 patella luxations, or we have dogs that have had more severe luxations and they've had surgery and then they're referred post-op. Often those are the dogs that have come for hydro and perhaps it's progressed, the luxations become worse and they've needed surgery, or the dogs for whom hydro really wasn't appropriate. I think the main thing that we're really lucky about in hydro is that we are hands-on when the dog's going through an active range of motion. And we're privileged in that the vet can't really achieve that. They can manually luxate. They can see how the dog's gait is. They can see if the dog skips to try and put the patella back into place. But we actually, as hydrotherapists, have our hands on the patella on both stifles at the same time while the dog's either swimming or treadmilling. The important thing to remember is that we should not be making the condition either worse because we have continual luxation and we're increasing inflammation and pain, or we should be able to report back and say, actually, this dog's luxating throughout the hydro session or throughout either in the pool or treadmill, and if they are, then hydro isn't an appropriate treatment. Sometimes the vets will say, look, try for a bit longer, see if it improves, but often what's happening is we're actually strengthening the quadriceps mechanism and we can increase luxation. So we see it both ways actually, because the quads are very weak, but also when the quads are strengthened, it can increase their pull medially or laterally, normally medially.
I suppose that depends on the torsion, if there's any how bad the conformational issues are. And what about swimming and underwater treadmill? Can you chat a little bit about the difference between those? Like if you had a patella luxation, for example, that it was a conservative case, what would be the best type of hydrotherapy if you had an option at your practice?
If I had an option, I would probably prefer to go to water treadmill, just because we're actually strengthening the dog against resistance to water in a weight-bearing situation. But some dogs we find luxate in the water treadmill, but they don't in the pool. So actually we can put them through a good range of motion. It's perhaps only when they really kick and go into full extension that they luxate, and actually we find less luxation in the pool. So it's absolutely patient specific. So I really couldn't pick and say one is better than the other. It would be really patient and condition specific, and it's totally based on our choice of treatment is totally based on when do we get the least luxation.
And when we're talking about luxations, I mean, I know majority of the cases we see are medial patella luxations, but what you saying now is that the same for if you have a larger breed dog, say, for example, with a lateral luxation?
I don't really differentiate. Sometimes they're easier to handle in the pool, but the problem with them is actually being able to keep your hands on the stifles when they're kicking, if they've got really long legs and then you can't keep up. But occasionally we find if we've got our hands on their hips and they luxate, you get a real clunk, and sometimes people will think that's their hips that they've got a problem with, when actually it's luxation at the stifle level. But the clunk and the feel of it is actually transferred throughout the dog. It's very clear when you get a luxation. It's a really significant clunk. One thing I will say is that sometimes, so what I've just been talking about is active movement in either the pool or water treadmill, but we can also just have the dog standing in water, and we can feel for luxation then, see how they luxate when they're standing. And I do have some dogs that don't luxate when they're swimming, but then they luxate just as they come into land and start to weight bear again. So that's when you get the clunk, and that's kind of acceptable because we can do quite a lot of work with them without getting very much luxation. But it's interesting to compare the luxation that you're getting either manually or sort of when they're standing compared with when they're active, when they're swimming or in water treadmill. And if you haven't got a water treadmill, if you've got a resting platform and it's a small dog, you can walk them against water there. And again, as long as you can get your hands on, you can feel what's happening. But it's really important. That's why it's so important to be in the water, hands on with the dogs. Otherwise, we just don't know.
So let's talk a little bit about the post-operative cases. It obviously is very surgeon dependent, but here in South Africa, I know that most of the surgeons are not that keen on swimming until at least 4 to 6 weeks post-op, but they would more tend towards you, allowing you to have them in the underwater treadmill, just because we have a lot more control of keeping their movements in a sagittal plane. What is your feeling on that, and how do you approach those cases?
With those cases, we would always choose to go to water treadmill if at all possible, because we shouldn't be getting luxation. We want to work them against resistance. We want to be hands-on. We want to feel how they are through, as you say, sagittal plane when they're weight bearing. So with those, I would choose always to go to water treadmill if at all possible. We see them, on about 4 to 6 to 8 weeks. It depends, because quite often we're seeing either we're dealing with sulcoplasty, so deepening of the trochlear groove, but we also have tend to come through a little bit earlier. But you have to remember, we're still in post-op healing. We still have inflammation. We also have dogs that have had perhaps a tibial transposition, so they will come through, so they may have had deepening of the groove and a transposition, and with those we really are waiting for fracture healing with those dogs, so they might not come through till 6 or 8 weeks. And it's totally, as you say, surgeon dependent, and also depends on if they're doing post-op x-rays to check on bone healing.
And so we had a question from Nico. What's the best way to manage patella luxations in a pool setting?
Hi, Nico. Nice to hear from you in Dubai. I find in a pool setting, what we like to do is swim in straight lines. Usually the smaller dogs, we have a resting platform. We have the owner standing by the platform. We carry the dog out backwards so they're facing the owner, so they're comfortable, and we gradually increase the length of the swim back to standing, because what I want is the dog swimming nice and square and straight, especially when we start swimming them. I don't want them doing turns. I just want a nice straight swim. And normally we'll have 2 hydrotherapists, so one to guide the dog and another one to have their hands on stifles and check for luxation. So we start quite gently. We want to make sure we're not causing luxation, we're not causing discomfort or inflammation. If the dog does well after the 2 or 3 sessions, then we'll build up quite rapidly. These are often younger dogs that are referred as well, so we'll build up quite rapidly, because what we want to do is get the dog really strong and stable so that they can cope with their condition better.
Awesome. And you said, you know, you can easily put your hand on over the stifle to actually feel to see whether that's you would be doing that continuously or intermittently.
And once we're happy they're not luxating all the time, so the first couple of swims we'll be very particular about making sure, but as we go on and we're confident when they swim, and we'll just check occasionally. It won't be constant, because I'd rather the dog can just kick and move freely. When we do have our hands on the stifles, it's a very light touch. You're just, it's very clear if they luxate. If they luxate perhaps once every fifth, sixth kick, it's not such an issue. But we have dogs, we get them in and they luxate every single kick, and then we have to say, okay, hydro in the pool is not appropriate. We might try treadmill, see if we can achieve it there. But if they've been referred to strengthen and we're causing luxation, then we refer straight back to the vet and just say this is not an appropriate form of treatment. And we may then go to more land-based exercise. We absolutely have to avoid causing luxation, because we're then eroding the cartilage, we're causing more inflammation and more arthritis, so it's not an appropriate treatment.
Have you ever found that moving towards more land-based therapeutic exercises and then getting them back into the pool once they've strengthened up a little bit, that there is decreased luxation?
Occasionally, but I don't normally find that. It's more to do with the range of motion they're going through when they're swimming. So there have been a couple of dogs where we've done that, but usually I find if they, if they're so bad that they're luxating continually when they're swimming, we can't strengthen them. They'll usually be the dogs that actually luxate quite often on land. They'll probably be the ones that end up going to surgery and then returning post-op.
So that same question, basically, what's the best way to manage patella luxations in an underwater treadmill setting?
Same thing really, isn't it? Start off very gently, be careful, check for luxation. If you don't have any or it's very intermittent, then you can push on with the dog and increase. I'd probably increase every couple of weeks, so you don't increase every single session. I'd certainly want to see the dog at least twice a week. If we want to grow muscle, we want to get the dog stronger, that's what we need to do. Often we're managing these dogs as puppies through their developmental stages, and they often stabilize as they get stronger and grow bigger. So and I think you've had that experience, haven't you, that they'll be quite weak young, and actually rather than rush into surgery, conservative management can work quite well for some of those. I would say that the most alarming thing we have is that when the dog's had surgery and they come in, so then we go to water treadmill and you put hands on and you've got luxation immediately, and they've just had surgery, and then you kind of second guess yourself and say, am I feeling the non-surgical leg? I'll just double check which leg has been surgery, and you find that you've still got luxation. It's quite a difficult surgery on very small dogs, and it's difficult to get right. Often what happens is the surgeons will just try deepening the groove and hope that that will do. But if you've actually got a femoral or tibial deformation, and that's part of the problem, you haven't corrected the underlying problem, or that's causing the patella luxation. You've just tried to get away with it with deepening the groove, and often they still luxate. Or I have had, they then luxate, say if they've tightened too much, they then luxate laterally rather than the original problem medially. So I think the most alarming thing we deal with is they're continuing to luxate after surgery. We refer straight back to the surgeon. Sometimes they say, let's stick with it. They're weak, they've lost quads, but we do have to make sure we've had that conversation and discuss with the surgeon.
I mean, you have great feedback with your surgeons to be able to see how things are going. It must be nice for them. Let me ask you one thing.
Sorry, going back to that, Megan, I would say that a lot of hydrotherapists and people I talk to in different countries have problems where the dogs are being referred back because they're still luxating, and the surgeon often doesn't really they don't want to do surgery again. They don't want to admit that it's gone wrong or it's a failure or whatever, and they will sometimes stick their head in the sand a bit and just say, keep doing it, just keep going. And that's really not good advice, because they're not understanding that we're causing more damage. So I have had dogs where we've had to send them back 2 or 3 times and say, look, we can't continue with treatment.
Yeah. Talking about the underwater treadmill, what water level would you suggest that these dogs are walking on?
Oh, good question. Always above the stifle. So we're certainly always at mid-femur or higher. Depends on the dog, depends on their makeup, deepness of chest or whatever, but you absolutely want to make sure that you haven't got the water level through the surgery site or through the patella. And if you think about it, what you don't want is the lower limb, so up to stifle, in water against resistance, and the top of the limb above the stifle is out of water, because then the biggest point of pressure is you know, on that cruciate ligament and on the patella, and we don't want that. So I would go deeper rather than shallower with the water. I know some people, perhaps as the dog progresses, might want to get better flexion of the stifle, and then they might go down to carpal and tarsal level to get the dog to actually lift the limb because they're trying to clear the water. But I certainly wouldn't do that on early stages of rehabilitation.
Some dogs with patella luxation, when they swim, don't fully extend or flex. I assume this is to protect themselves. Would swimming still be beneficial even though a full range of motion is achieved? We're waiting for with treadmill, so only a short-term problem. Thank you.
I don't really see it as a problem. Dogs really only extend when they're really pushing and they're wanting to get somewhere, and they will always stay within their comfortable range. So certainly my view is that we are not going to try and get the dog to fully extend or fully flex. They don't tend to do that when they're swimming anyway. They tend to sit slightly more flexed, in a slightly more flexed position than they are when they're in the water treadmill. I would be comfortable with that. It's still beneficial. They're still strengthening. They're still bringing the limb against the resistance of the water. As long as they've got good range of motion on land and on assessment, I wouldn't be too concerned about it.
Great, thanks, Angela. And then Vicky asks, she's got a case that has a patella luxation on the right hand, mild hip dysplasia on the left hand, and it's also a brachycephalic dog, which is 11 months old. What would your approach be?
Probably treadmill if at all possible. Brachycephalic is going to be more difficult to swim in the pool, but it depends if the dog likes swimming. I don't know. I don't quite have enough information. So Vicky, if you're listening, maybe come back and give us a bit more info on what size of dog this is. You say he has immature ligament growth, and I'm not quite sure what you mean by that, if the dog has a particular developmental problem or nutritional problem. So it would be good to have a bit more information. So I can't really give precise advice for this dog because I don't have enough info, but I would tend to go to water treadmill if I could with this particular dog. But pool would still be useful, you know, as long as I say, are not luxating while they're swimming. But obviously it's slightly more difficult with a brachycephalic dog, which would push me towards water treadmill. And really that illustrates, doesn't it? Every case is specific, and in every case you go through this, yeah, but this is a plus, that's a negative, which way should we go? You do all your prep, you go, right, we're going to go this way because this is the most appropriate treatment based on our experience, and the dog has completely different ideas about what it's happy with. So again, we're lucky that we can choose between, but I'm sort of guided by the patient, and we often decide to go one way or the other. They're such an awful swimmer, we just say, like, let's forget that, let's try treadmill, or vice versa, they're not comfortable. Some of these dogs are quite uncomfortable when they're weight bearing, so they're actually a bit more cooperative in the pool. So just so patient specific, it's very difficult to second guess sometimes.
I just wanted to comment, I know for when I treat hip dysplasia, I prefer to use the underwater treadmill, so maybe for that case that'll also be beneficial.
We do with the HD cases. Quite often when they're first referred, they're quite painful. You know, that's why they've been referred. They've just been seen and they've just started on anti-inflammatories, joint supplements and other, you know, exercise management. So sometimes we start them in the pool, get them comfortable for a couple of weeks, then we go to water treadmill because we prefer that for strengthening and extension of the hip. And really, what I really like with those cases is a combination of treatment. So we'll treadmill and then we'll go to pool, and then, you know, sort of use that as a kind of warm down and non-weight bearing exercise. And I find the combination is quite powerful and works really well, especially with the younger dogs.
I think also the swimming in the pool is a lot more fun for most of the dogs.
Yeah, and us.
I had this one golden retriever that had hip dysplasia that used to love the underwater treadmill. Her name's Candy. She absolutely loved it. But I wouldn't say the rest of them really loved it. You know, they weren't super excited for it. You can see the dogs when they're going to jump in the pool. I mean, they just love it. They're really, really excited.
So we use it as kind of the reward, like cooperate with the water treadmill, get your work done, then we can go and have some fun. And they don't realise it's doing them good as well, do they? So, and we do have some dogs that absolutely, they tend to be the working dogs and the collies that really want to go, and they will actually bark to make us switch the treadmill on and make it go. So they like that.
Yeah. All right, Angela, thanks so much. I'm just going to see if there's any more questions. It looks like that's it. Yeah, I hope you guys learned lots. Thanks so much, Angela, for your time. I know you're hectically busy, so we really appreciate you finding a little time.
I'll check in.
Guys, have an awesome day. Thanks, Angela.
Bye.
Bye.
If you enjoyed listening to this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about veterinary rehabilitation. For more information about continuing education for vet rehab therapists that you can do online, you can go to onlinepetshealth.com. I'd like to thank you for listening to this podcast and of course thank our sponsors, Pulse Vet. We thank them for their commitment to their mission to improve the quality of life of the animals that we all love by developing, validating, and providing advanced shockwave therapy at the highest level of support and service. Remember, you can reach them at pulsevet.com or info@pulsevet.com. See you all next week.